So my research specifically, a lot of it has been focused in, for example, the opioid work that I talked about, being able to take that from an opioid epidemic that we see across the country and moving that into saying, what are the risk factors? What kind of predisposes a person to having an opioid addiction, and finding ways that we can reduce that and kind of immediately have an effect on patients across the country is exceptionally thrilling. Despite how much I love doing research, I think the big thing is that motivates me to do it is kind of changing patient care. Being able to take a question and going from a question to translating it to a new patient care method is fascinating to me.
So for me, I have a big interest in underserved communities and knowing how much research can help and improve those outcomes, knowing that there's a disparity in diverse participants in research, and then knowing that there's also a lack of conditions studied that affect these minority populations. And so having those interests, I feel like pursuing research can really help me increase the amount of diverse participants in research, and then also increase other trainees and people who look like me and get them interested in research as well.
I look at research as just a way to really channel creative energy, because when you're able to do that, you're able to really understand the approach that you're making towards your patients. You're really understanding the individualized needs that these patients need. And from that, you're able to really channel, again, that innovation, that creative mindset that, how can we do this better within our system? How can we really make our outcomes better? And that, I think, is what I can do with research in my career.
Definitely working with the patients is what excites me. Already, my research in these people living with HIV has shown that there are many barriers to healthcare in this population, including the lack of access to long-term healthcare. When we're able to identify certain barriers that impact a certain population, those barriers can be taken at a policy level and can be used to drive policy and more directly impact these vulnerable populations. It's these big upstream policy, education, and research changes that really drive long-term and make lasting impacts for these populations. And so I wanted to use my skills in dermato epidemiology to directly contribute to those efforts.